Welcome to the Green Nurse Podcast, where we bring hope and inspiration for growth and healing. We are here to change the dialogue and stigma around what it means to feel good and be high. So I'd like you to consider this an acronym. H is for hope, I is for inspiration, G is for growth, and H is for healing. Hope, inspiration, growth, and healing. So here's a little video about what we do in the cannabis industry as nurses and how we're changing the paradigm of healthcare, teaching on the endocannabinoid system. Here we go. Let me just pull that little video up and we will get started. Okay. Yes.
Change the paradigm of healthcare.
The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I'm the founder of Holistic Caring. We're based here in California, and we do educational programs and case management for patients on how to use cannabis therapeutically as a medicine.
We're also here to decrease stigma around what it means to feel good and be high, hence the H for hope, I for inspiration, G for growth, and H for healing.
As the founder of Holistic Caring, I basically oversee the whole ship, and what we're doing is progressive education.
Cannabis actually supports all 11 organ systems, our immune system, and all the neurotransmitter signaling systems that give messages to tell our body to either do something or not do something. Because the plant was prohibited, it prevented health professionals, doctors and nurses from learning about cannabis as medicine.
I want to change the paradigm of healthcare and us paving the way into a new vanguard of medicine. And I'm excited to really bring this into light. There's a company called Canam that we're merging with, and we will now be doing global education.
It's about education, it's about empowerment, it's about teaching people how to feel good, bridging the gap from what they're not getting from traditional medicine, utilizing different plant medicines, adaptogens, tips, tricks, hugs, and nugs of information to support and nourish the most important system in our body.
And it's a lot of soul work, a lot of love, a lot of discipline, and meditation. I'm using my life work as a testimony to others to learn how they can be their own hero and then go help heal the world.
And we are, as nurses, the game changers.
Sherri, you're muted.
Muted. Whoa, I've been chatting and I've been muted. Well, what do you know? Well, thank you, Dr. Blair. I truly appreciate it. So let's get started once again. So here we are. Welcome to the podcast, everyone. My name is Sherri Tuckus. I'm the VP of Nursing at Holistic Caring and the Green Nurse. And I'm really, really excited to share the love of plant medicine and all the benefits that it provides to the endocannabinoid system. So today's show is truly going to blow you away. It blew me away once I met Dr. Blair. And so this is what's prompting me to do this show. It's because the endocannabinoid system is the most important system in our body. So it makes sense that we support that system. We do things that nourish and support it and eliminate those things that don't. So as we know, cannabinoid therapeutics is much more than just cannabis, because everything that we do or don't affects how the plant works in our body and affects the endocannabinoid system. So what if there was something that you could take that would support and nourish the endocannabinoid system that wasn't cannabis? So this is going to be a really, really good topic to talk about today. So I'd love to introduce Dr. Philip Blair, Colonel Philip Blair, retired U.S. Army and family physician. He is a consultant in disease management in the Northwest. He graduated from West Point in 1972 and University of Miami School of Medicine in 1978. He's trained in family medicine and served as a combat physician in the 1990-1991 Gulf War. After medical assignments in 3 continents and 29 years in uniform, he retired from the Army and has been consulting on complex disease management. Since 2014, Dr. Blair has been studying, treating, writing, and lecturing about cannabidiol and the human body's natural endocannabinoid system. Endocannabinoid system dysfunction appears closely associated with the full range of chronic illnesses. His goal is to restore health and performance by enhancing the endocannabinoid system through diet, exercise, appropriate medications, and non-psychoactive herbs. In 2021, he co-authored the Medicinal Cannabis and CBD in Mental Health Care and developed BCPLus, an oral non-cannabis CB2 activator from Caryophyllene. So I'm really, really excited, Dr. Blair, for you to be here today. It was an honor to meet you when we met at the Cannabis Science Conference, CanMed Conference. We've been the Patients Out of Time Conference. So you've been doing all the conferences and circulating just this amazing thing that you've been doing and creating for people. So welcome to the show. Thank you for joining us. And let's dive in. So the big question I always ask clinicians, we don't wake up one day and say, hey, I'm going to be a cannabis nurse. Hey, I'm a doctor. I'm going to go into cannabis. There's usually a compelling story or something that surrounds the mission or the vision or the passion to move forward in this space as a clinician. So how did you get involved?
Well, I was trained as an MRO. I tested people for cannabis use. I was locked into the standard regimen, which means that no cannabis. You got to avoid cannabis. It's a dangerous substance. But then I met the founder of Elixinol, one of the founders of Elixinol, who invited me to speak to clients on CBD. Well, I was kind of in the midst of a change, and I was doing disease management, and I was looking for something herbal that could work for many patients who were suffering. And the diet worked pretty well, but we needed something more. So I was interested in it. So that's when I started doing the research. I started reading about it, and I had a chance to try it for myself, my family, my clients, my neighbors. Everybody got CBD, and I wanted to find out exactly how they would respond. And I discovered so many things. There's so many benefits of this substance. I had just a huge trial and experience. And so that was in 2014. So the last 8 years, I've been dealing with cannabidiol and cannabis, but mainly cannabidiol in its raw form.
Yeah. So I have a quick question. So as you started to enter into the space of working with Elixinol and working with patients with CBD, what was your biggest aha moment about CBD? Like as a clinician, as a doctor in the space, what was the aha, the wow? Well,
that it was an entire body system. The endocannabinoid system was this huge system that we hadn't been taught about. There was no knowledge about it. It was suppressed for the most part of everything that was going on, and most physicians didn't have a clue about it. And yet it was so paramount and so significant in managing and as a master regulator of all the body systems, as a matter of fact.
Yeah, I was blown away too. The same thing, like learning about the pleiotropic effects. And people were like, what is that? Working on multiple different systems all at the exact same time. We have 11 organ systems, our immune system, and multiple neurotransmitter signaling systems that give messages to tell our body to either do something or stop doing something. So it's just so amazing that we have this one master regulatory system that controls it all. And then how we create components in our body, very similar to the plant.
But what's unique about the endocannabinoids, about the phytocannabinoids, is they are benevolent for the most part. They are orchestrating the positive changes and life balance changes rather than part of disease. So typically we have different receptors, and thereby some receptors are active and they're positive, and some receptors are inflammatory and very negative. So you don't want those, but all of the receptors that are involved with the phytocannabinoids are very, very positive used in the right way.
Yeah, absolutely. So once you started to step into the space, what kind of conditions did you start treating? Like what kind of patients were you working with?
Whoa, as being a family practitioner for 45 years made me aware of a vast majority of illnesses. Now, even though I was not an expert in any one disease, I had a
Mhm.
good understanding of the causes, and I felt very comfortable advising patients on dosing for cannabinoids. And so, at the core of almost all of these problems, I determined what the fundamental problem was inflammation. Almost always inflammation is at the core level of the problem and the disease manifestation. But there are subtle other things that are going on.
Right. Makes sense. Truly makes sense. I always tell the
So,
older folks, I'll say to the aging population, I'm like, listen, you don't die of old age. You die of old age related diseases that's completely 100% affected by how inflamed your body is. So let's work on the inflammation piece of it, because you decrease inflammation, what's going to happen? Your operating system's going to work a little bit better, correct? So,
that's right.
yeah.
In terms of illnesses, I've treated anxiety, depression, PTSD, MS, multiple sclerosis, Lyme disease, COVID, cancer, neurologic manifestations, epilepsy. I've treated everything. I think, I always look for a new diagnosis that I don't know anything about. I want to dig into that. Particularly, I find that some of the genetic disorders are particularly interesting. That I have found connections with the cannabinoid system with those genetic defects, and they can get around that because the primary problem is generally inflammation. If you can alleviate that inflammation and correct for that factor, then you can restore health to these people.
Yeah, interesting. Very interesting. So what are the most significant treatment successes that you've had working with medical cannabis?
Well, I think my favorite was Joe. He was an 82-year-old veteran who presented as Alzheimer's disease. He was sitting in a chair. He was staring at the television. He was practically in a vegetative state when I met him. So I prescribed some cannabinoids for him, and I wasn't sure if he was going to get better or not. I just was. He had a long history of being in the military. He was actually in the Korean War, but none of this came out. He was just blank. He was just like a vegetable. But I got him started, and he actually found that he felt so good that he took extra doses, and he may have overdosed on the subject because he had such a dramatic turnaround. He restored his energy, he restored his balance, he restored his talkativeness. He started telling stories about his Korean War experience, and it was evident that he had PTSD from that experience because nobody had ever heard the stories before. And he was actually going on a weekly basis or to a hospital to discuss with a group that was going to discuss his PTSD experiences. But the family didn't know it. And they were so surprised when they heard about his stories. Well, he asked me to help him write a book about these stories. I couldn't do that, but it was really impressed. And then he commented that he no longer felt like a piece of broccoli because
Aww.
a vegetable, in the world. And so completely restored him. He was just a marvelous human being after that.
That's amazing. And that's, you have to think about that. As we get older, what do we want to do? We want to maintain mobility. We want to maintain our independence. We want to maintain cognition. We want to, right? These are the things we want to do. PTSD, so you have a veteran with Alzheimer's, right? The quality of life is what? Difficulty having a hard time just doing anything. And then you compound PTSD with that, where they have those triggering factors where they get stuck in the loop of the story. Quality of life goes down even more. So I just find it very fascinating. And then this is just going to bring up the next topic we're going to talk about, which is really important, is what? Let me add this to the stream. Your book, Medical Cannabis and CBD and Mental Health Care. Yes, your book. We have to look at, as clinicians, and I'm sure you're aware of this, as clinicians in the conventional system, what are we focused on? We're focused on disease processes, body parts, pills, procedures. We have to, that's part of the process. But what's lacking often is mental, emotional health, unless someone is in a mental emotional crisis or in a PTSD flare, I call it, or it is experiencing trauma. And rarely do we ever get to spiritual health. So I find this just very, very fascinating how, that you're taking a huge interest in other health professionals and really addressing mental health, mental wellness, and how medicinal cannabis can be beneficial, because we do see a lot of stigma around that, in the community of working with a lot of different patients that have a lot of different conditions and orders, specifically in the mental health compartment, is that they're plagued with the stigma of, oh my goodness, even CBD is still part of as cannabis and hemp. And are they going to think I'm a stoner? Are they going to think I'm overdoing it? So we really are. And so having a book as a reference guide for people to really, truly understand how to bridge, how can you work with plant medicines? How can you work with CBD that's going to provide you the most beneficial outcome? So this book is very, very rich. Will you tell me a little bit about it?
Well, essentially is a medical text. And I've gone into a great deal of detail on major complications, the major problems with behavioral disorders. So anxiety, depression, Alzheimer's disease, bipolar, autism, all the general categories that we deal with and that most people are concerned about. And I address them in ways that we're looking at the endocannabinoid system as the key instrument for modification and the source of all illnesses, the major part of these illnesses. And now we do leave out psychosis because that got too involved, but it's about 500 pages, so it is a pretty good text for reading. And I also provide examples, some case studies that I've done in my practice. So it elaborates and it gives you examples of how to use the cannabinoids and which cannabinoids they can be changed about, and how they can be used for the modification of people's health using the endocannabinoid system. And the final crux of this is that this phytocannabinoids should be the primary therapy, the first line therapy, not the secondary approach or the alternative approach. They should be primary therapy for behavioral diseases because they can take care of all our behavioral needs by the majority.
Yeah, I've, in my experience working with patients, I completely agree with you. Working, with gut health, with the microbiome, working with, one of the most fascinating things that I learned with working with patients and in studying, cannabis as medicine is how our enteric nervous system from our mouth to our butt communicates to our central nervous system via the endocannabinoid system. How cool is that? The gut-brain connection, the endocannabinoid system is that pathway of communication. So it just makes sense. The more we can supplement and nourish gut health and so support our microbiome, how we're going to see significant changes in inflammation in our central nervous system when it comes to cognition and behavioral health. That nutritional psychiatry piece of it, I've seen really, really, really great outcomes with people that are using, herbs and supplements and cannabinoids and diet and nutrition, healthy foods, whole foods, and how it works. So, and this brings me into the next question, because when we talk about cannabinoids, we know that phytocannabinoids, the plant makes, THC, CBD, and all the minor cannabinoids. And we know the pharmaceutical company makes synthetic cannabinoids. We have Epidiolex, Sativex, Dronabinol, Marinol. And then we make internal endogenous cannabinoids. And you've heard me all talk about it before, anandamide and 2-AG, but there's a couple of other ones that we were talking about. So PEA and OEA, those are internal endogenous cannabinoids. So will you tell us a little bit about those?
Well, PEA is palmitoylethanolamide, and that is very similar to the name for anandamide, arachidonyl ethanolamide. So they're cousins of arachidonyl ethanolamide, anandamide, and they're actually kissing cousins because They have complete endocannabinoid benefits, and they are positive changes in the body. Now, interestingly, you transition from the gut and the microbiome, and these have major roles in the gut. They have particular effects in that area. Now, PEA has been studied extensively in the management of pain, COVID, arthritis, anxiety, depression, Alzheimer's, stroke, autism, neurodegenerative conditions. It's even been considered as an alternative to cannabidiol in some sectors. Now, OEA is also an endocannabinoid. It is very, very interactive with our gut, and it orchestrates many of the benefits of the gut and some of the problems that go along with it. Now, particularly OEA agonizes with a receptor that reduces, that's in the pancreas and the GI system, and it regulates the food intake, obesity, atherosclerosis, and lipid metabolism. Now, PEA is mainly primarily neurologic, the benefits of it, but they are so beautiful in their benefits, and there are no significant side effects. They're available on the market. You can buy them at Amazon, and they are terrific for selected type of problems. Now, they're both fatty acid amide hydrolase inhibitors, so they all elevate the function of the endocannabinoid system, and they regulate the PPAR receptors, which tend to influence metabolism. So it's a good chance that they're going to help your metabolism correct for obesity, for lipid abnormalities, for atherosclerosis, all those things. And OEA actually connects and signals the CB2 receptor, which is the receptor that controls all of our immunologic system.
Wow.
So, that's in a short picture, but it's a huge topic, and these things can be very beneficial, I've found.
Yeah. So, which is just amazing. So you can purchase these different cannabinoids that are cousins to anandamide and 2-AG, and that PEA has neurological benefits. OEA is gut health and immune benefits. One of the things I heard you say too that I just want to talk about is the Fa enzyme. So these can inhibit the Fa enzyme. So when we inhibit the Fa enzyme, what happens? We have our own anandamide circulating in our system longer. Is that correct?
That's right.
Right. And so our anandamide molecule, right, is the molecule that's most like the THC molecule. So you just imagine, so this is one of the things that I love when we're talking about, the exercise and diet and nutrition. If you're taking CBD and you exercise and you get that really good runner's high, you're feeling good, and you take CBD, guess what? You could prolong that effect, right? So if, the Fa enzyme breaks down our anandamide molecule. So if you're in the presence of CBD and some of these other things, if we can OEA, PEA, we want to have our anandamide molecule working efficiently. So those messengers, we can give those messages, hello, do this, stop doing that, correct?
By blocking the Fa enzyme, you actually are upregulating the endocannabinoid system. You couldn't ask for a better plan.
There you go, even better. Now we're going to get into my next favorite topic and the product that you created. So Beta-Caryophyllene, to me, I am really, I'm not going to lie, completely grateful for this terpene and cannabinoid. I'm going to pull up a little document here, and we're going to discuss it. So Dr. Blair, this is your specialty. So I'm going to let you dig into what is Beta-Caryophyllene and how does it work? And then we'll get into your specific product.
Well, Beta-Caryophyllene is a terpene that is found in many nutritious foods such as black pepper, cinnamon, and hemp. And actually I learned recently it's available in grapefruit as well. And it works as, it has this tremendous benefit in these foods. And so terpenes are what we smell. We typically get an odor from, and these typically have that odor, but it's acting as a food flavor enhancer. In fact, the FDA has approved BCP as a safe food flavoring, and there's no toxicity and no adverse effects with all the studies that have been done on it. And there have been over 3,000 studies that have been producing on it. Now, the way it works just like cannabidiol. It signals receptors on the endocannabinoid system and all over the place. It's got probably over 125 receptors that it engages with, and it works in an adaptogenic manner, meaning that if it's something that needs to be restored, it restores it. If it's something that needs to die, as in a cancer cell, it kills it. And its all purpose is to normalize the endocannabinoid system for our health, both physical and mental. Now, BCP activates the endocannabinoid type 2 receptor, which regulates every immune cell in the body. So it's magnificent for any kind of inflammation, any type of inflammatory reaction that's occurring anywhere in the body. And it also activates other receptors that regulate pain and metabolism. Now, the CB2 agonist is a CB2 agonist, along with being the PPAR alpha and the PPAR gamma. The opioid agonist, it's an opioid receptor agonist, the TRPV receptor, and it also inhibits the Fa enzymes as well. So you've got a whole multitude of effects from this.
All from beta-caryophyllene, right? Think about that. So you just imagine, and I'm going to share my experience with it in a little bit, but I'm seeing great results with patients and even with myself, and we can talk about that.
So the typical dietary amount is between 10 and 200 milligrams. Now, this product doesn't have that much in it. It only has 30 milligrams per milliliter, but the delivery system in a liposomal format makes it available to your body, to your brain, to all your cells of your body within 10 minutes for a dramatic change in your personality.
There you go. And so for the new viewers, they may not know what liposomal means. So will you tell us what liposomal is and why you developed it in a liposomal format? There you go.
Well, the liposomal format was, I found that with cannabidiol, that it was an ideal form for delivery of cannabidiol because it was reasonably taste, it had a great texture, it was a small dose, meaning you don't have to take very much of it, and you get a magnificent and a multiplied effect. Now, the way they do that is they take a fatty-like substance, then they surround the BCP molecule with it, and then that's phosphatidylcholine, and then that becomes like a bubble, and that bubble is water soluble, but it contains fat on the inside. And so you've got this excellent delivery system, much like the way we use vesicles in the body and the way the body absorbs things through these vesicles. That's what we've designed this as a liposomal technique.
Nice. Excellent. So what conditions have you seen BCP be most helpful with?
Well, the most helpful has been with, first of all, it treats everything that cannabidiol works on. It does it all. But it has a particular great emphasis for neuropathic pain, particularly neuropathic pain, neuropathies of any kind. It seems to rectify those very quickly and can be complete. And then it works on gut pain. I've had people with severe gut pain from all sorts of causes, and it's rectified their pain as well as their constant diarrhea. It's corrected that, or it's corrected their constant constipation. It has really put them back into good order and good function in the GI tract. And the third thing that I find most powerful, very, very powerful for a minority of patients, and that is eyesight. It has, it's vision restorative. It has corrected retinopathy, macular degeneration, diabetic retinopathy, and other types of retinopathy, as well as glaucoma. Now, nothing else that I found has been able to do this, and there's nothing on the market that can do this, but this is profound in terms of the benefits that you can receive from this.
This is really fascinating. I'm really glad that you brought that up, because a lot of patients that come to us will, because a lot of the qualifying conditions for medical cannabis cards are glaucoma, but I have glaucoma. The interesting thing with my glaucoma, I needed to have laser iridotomy, which is a surgical procedure. But a lot of patients, we've seen, and it's been studied in research, but the thing that's interesting about cannabis consumption with glaucoma is you need to have a steady level in your body. So how, looking at that can be very dangerous. So when I was working with a lot of ophthalmologists, in asking them their thoughts on it, and their thoughts were that they are in favor of cannabis as a supplement to the treatments that they're prescribed, just because eye pressure, you do not want to go blind. It's one of my big things is that, once your eyesight's gone, it's gone, specifically from glaucoma. You blow that optic nerve and you're all done. So I find that this is very, very beneficial, that this can actually work on that, with no side effects, and with, and to be a supportive. So have you found patients being able to take that? Do they take it in conjunction? So, because the eyesight piece of it is really, really important to me, A, because I do have glaucoma and have been treated for it, and B, we do have a lot of patients that'll see that as a qualifying condition, and they think that they can just take cannabis to manage the glaucoma. And that makes me just a little hesitant as a clinician because of what I know. What are your thoughts on that?
Well, I haven't encountered any patients who are using cannabis for glaucoma, or that they've had a failure of using cannabis for glaucoma, and so that mine are de novo patients. Mostly they have macular degeneration, and oh, by the way, they have glaucoma. But I have a few original patients with glaucoma as well. Now, the reason it works on glaucoma and retinopathy is because it attacks 8 different inflammatory mechanisms in the eye. And I was just amazed at the complexity of this, but the primary benefit is the CB2 receptor activation that is premier in the benefits of the eye, as well as the rest of the body on inflammatory conditions. And this goes to the very heart of the condition.
Amazing. I'm really blown away with this. So so you instruct patients, the patients that are coming on these products, you instruct them to do a user report. So as nurses, right, we want to document, right? So this is for yourself as well. A lot of times with cannabis patients, when I was new to cannabis, I didn't journal. I didn't do anything. I thought I, could figure it all out on my own. But I remember going to a dispensary, scratching my head going, did I try that before? Did I, and then basically I get it. I bring it home. I'm like, oh my God, I had that before and I didn't like it. Oh my goodness, I bought it again. So that is what inspired me to teach people how to journal and how important it is, because what we want to look at is what trends, right? Is it helping? Is it not helping? What are you doing? What are you not doing in conjunction with it? So really to have the opportunity to just track how this is making you feel, what other changes are you making, and are your symptoms getting better? Is your quality of life improving? So tell us about this little user report and how you use this. I love this.
Well, what I found was that there are certain characteristic benefits of using the BCP that were very consistent, and I listed them all off because people don't always recognize them. They come to you with a primary complaint like, oh, I've got pain. And so they always focused on that one thing, but there's so much involved with pain, and there's so many other benefits that come with it. I call them the beneficial side effects most of the time. And I developed this particular format with the number of benefits that people see. And if you'll take a notice of yourself before you take the BCP, and within 10 minutes after, you should see significant changes in these parameters. And I wanted to capture that not only for the patient's benefit, but for my benefit. Hopefully I would get these in return, and I would see some of the benefits, because nobody knows anything about Caryophyllene. Nobody knows about it. And this is a massive education program over the whole world that I'm trying to get to. And I'm so pleased that you are offering this at this time so that I can share my findings with the world.
Yeah, absolutely. And I actually have a couple of patients that we can talk about really quickly. Well, myself in general, I'm going to tell you what I've noticed.
Well, one other thing I want to get across is that there's an immediate benefit to using these products, and that I put together a little piece of little paper that is talks about the the immediate benefits, and then the challenge dosing that people use with it, so that you start off with a small dose and you increase that to a larger dose depending on what your response is, and you know if it's going to work within 10 minutes.
Yeah, I've seen amazing results. I won't go without it. And so, using this, I use this as a topical. This is great. BCP topical gel. You want to talk a little bit about this? I like this.
Gel.
Yeah, this is amazing. I use this all over my face and all over my shoulders. I have a autoimmune condition. So, I've got an endocannabinoid deficiency, right? And so the goal of cannabinoid therapeutics is take the least amount to get the most beneficial results below the threshold of being impaired, right? It's really, you're using cannabis medically to feel good, not feel worse. So
cannabinoids in this case.
Cannabinoids. Yeah, cannabinoids. So what I really enjoy about these products is that, as a medical cannabis patient, and I disclose, I need a lot of THC to manage some of my symptoms. It's particular times of the month, particular days, depending upon what's going on. I have found, and I'm tracking it, I am not needing THC as much in the daytime. I'm starting to need less of it in the daytime, and I'm generally not starting to use THC until the evening. So that has been a big, because A, you're saving money, and B, right, what's the goal? The goal is to support your endocannabinoid system to start doing its own thing. We want our body to be creating its own internal endogenous cannabinoids. Too much THC, what happens? Your body says, oh, good, you're giving me all I need in THC. I don't need to make any more anandamide, right? So we don't want that to happen. So this is I'm finding this to be a really, really great tool to decrease the amount of THC that some patients need. It's saving them money. It's improving what they're doing. A lot of times patients over time, their formulations, the way they take it, their methods of administration have to change. And so we switch it up, usually every 6 months. And so patients that'll come, instead of switching it up completely, let's add something and see if you don't need to do anything else, or maybe you can decrease some of your other cannabinoids. So I'm seeing that this is a really, really good booster, a really good enhancer. And I think this is going to be a cool, amazing product for people that are brand new, that are afraid to use the plant, that are afraid to use cannabis or hemp products. They can get this and try this. And this isn't from cannabis. We tell everyone, what's in it, how it's made.
The source of the BCP is actually allspice and Roman chamomile. And then in the gel, it comes from hops. So it doesn't come from cannabis at all, and doesn't come from hemp. And it has superb properties, and it has all the superb properties that you would expect from a cannabinoid as very selective. But because it doesn't come from hemp, then everybody can use it. The military, the police, the certified, the CDL drivers, medical personnel, addicts in rehab can use it, athletes and government employees. The list is endless of who can use these products, because it's a nutraceutical. It's a nutrient that we should be taking in our diet, and we may not be getting enough, or we may not get the concentrations and the effective delivery system that this products offer.
Yeah, really, really good job. Good work. So let's talk a little bit about Blair Medical Group, what you're doing with your company, your business philosophy, and what type of consultations that you do.
Well, I do all forms of medical consultation, and I advise people on how they can use cannabinoids for their benefit. And I will use a selection of properties and products, whether it's PEA, OEA, cannabidiol, or Beta-Caryophyllene. They all have the potential, but there's all different kinds of ways that you can take it. So I advise people on how to use that, and I offer a friendly and realistic understanding of the problems that people are going, and I sympathize with them in their criticism of the medical care system and how unresponsive it is, and how every doctor wants to add a new drug onto them, where I offer them a selection of cannabinoids that they can withdraw their other medications from.
Yeah, excellent. Now, besides cannabis consulting, do you also do, primary care? Still primary care?
No, I'm not out of that. I'm not been in that for quite a while.
Yeah, I just thought I'd ask. You never know. So, okay, so that's great. So your business has grown out of your desire for highly effective products for your patients. So we know that we just discovered you offer, so we have your website up there. You offer the BCP, you offer other cannabinoids, you offer PEA and OEA as well.
Well, we offer that as a therapeutic option for
As a
patients,
therapeutic option.
and
Okay,
we can
great.
discuss with them the benefits of that.
Yeah, excellent. And then how about this? Do you have any clinical studies of your products yet?
No, and that's what we're dying to do. There's only been about a
Okay,
dozen or less of clinical studies in humans that have been done on beta-caryophyllene. So we're really lacking. I've got a project going on with Yale University for doing a neuropathy evaluation. I've got one going down in Brazil that is proposed. I have a mouse study that is going on in Maryland, and
Nice.
that's underway. And then I put in a bid for Australia to do a project with Canem. That we can
Nice.
probably make something happen with that.
Yes, excellent. And then we're also looking to launch, this is going to be a great thing. So as nurses, we are educating on the endocannabinoid system. We're using anything we can to help the cannabis products work better, to decrease, to improve quality of life. And so one of the things that we're going to be doing is we're going to be launching, I'm not sure exactly when, we're working on it now, is an observational study where our nurses are going to be looking at all the different things that patients are taking and going to be tracking it with an app. So, and we can't wait to do that. And honestly, too, we're looking forward to getting this in our Green Nurse approved marketplace. So when we're done, we have to talk about that. Elizabeth's like, don't let him go. We got to get this into our shop. So we're going to work on doing that. So this is great. So studying this, you have a ton of real world evidence. So observational studies, real world evidence, I call them the anecdotal stories, are what should be driving the research. So when you hear patients saying the same thing over and over and over again, that should kind of inspire you to really kind of take a deeper dive. So that's why I really love everything that you're doing with this and really, keeping close tabs and gathering the data and pushing, because this could be a huge game changer for so many people that are suffering. To get the benefits.
I'm sure you're right. I have addressed all manner of disease with this successfully: epilepsy, dementia, diarrhea, PTSD, breast cancer, brain cancer, kidney disease. And that's only been in the 6 months that it's been available. It also addresses menopausal symptoms, anxiety, depression, low libido in women. It's actually rated for that it could inspire some of the libido in women as well. And it's lowered hemoglobin A1C 2 points and cholesterol by 60 points in individuals.
There you go. So listen, if you're out there, if you're new to cannabis, if you're new to plant medicine, if you're curious, you can book a session with Dr. Philip Blair. We have his, let's put this right back up here. This is the website where you can get the product. And this, where did you go here? Here you go, blairmedicalgroup.com. You can book a coaching session. So definitely check this out. I highly recommend it. I don't bring anyone on that I'm not willing to literally raise my hand and vet. As a cannabis nurses, it is very, very important for us that patients get high quality products, right? It's expensive. Cannabis is expensive. Taking care of ourselves is expensive. So we've done the homework for you. We are vetting these products. And Dr. Blair, I am extremely grateful that you came on today to share all of this with us. We're getting close to the end. So I wanted to know if you had any other
I wanted to
words.
ask you about
Sure.
gel. How did you find gel works for it?
This is amazing. Okay, so I use it for chronic
It
pain.
actually works in 3 different ways. It works on the skin rejuvenation, it works on inflammatory lesions, and it works for pain. So you've got a triple benefit coming from it.
I'm not going to lie. So using it, so I have a history of migraines. I have a history of an autoimmune condition called polymyalgia rheumatica. I have a lot of, I would call CB2 activator conditions that really need this. And, using this topically has been really amazing, specifically pre-workout, post-workout, after the shower. And then the thing that I'm learning, and I'm not going to lie, I'm a little vain. I want to stay young. I want to stay healthy. I use it on my face. And you only need a tiny, tiny, tiny bit. A little bit goes a long way. And I feel like my face becomes alive. That's the only way I can. I don't know. I've been using it. I use it every day, just a tiny bit once a day on my face, and I feel like I feel more alive. I feel more youthful, and I think it's going to be a great thing. It's very reasonable, and you can use it in multiple different ways. I lost a toenail. Okay, I know there's a little bit too much information for people, but I stubbed my toe. And literally over the course of the past 4 weeks, my toenail came off. And so I've been putting it on there, and it's just very interesting to see the changes every day. So I'll send you my toe pictures as it starts to heal.
That's great. I love them.
Yeah. So it's very, very interesting just to see and to work with
I
these
want to
different
see
things.
as much feedback as I can get on this product because it's so new.
Yeah. Good stuff. It's really good. So really, really grateful. So we're going to wrap it up. And while I wrap it up, I have to promote. We're going to be traveling. So next week, we are not going to have a podcast because we are going to be in La Jolla, San Diego for the Cannabis Nurses Network Conference. So I'm going to be presenting on, you guys ready? Spirituality is the root of cannabis care. The art and science of nursing, a return to love. So that's going to be a really, really beautiful segment. I'm going to be bringing in nursing theory. What is the art and science of nursing? What is it? Why are we doing it? Why do we need to look at nursing theory? And what does the concept of being high have to do with the art and science of nursing and a return to love and spirituality? So I'm going to take a deep dive into that. And we're going to talk a little bit about Jean Watson, who is the nursing theorist way back when. She was the first one that introduced nursing theory to nurses. And her nursing theory is it's the human caring theory. And her statement is the essence of nursing is human caring. It's caring for the entire human experience, not just one part, but all parts. Bio, psycho, social, spiritual healing. So really, really excited, going to be together with all of my nursing colleagues all throughout the country. There's a lot of nurses that are going to be coming. A lot of nurses are going to be speaking. Big shout out to Cannabis Nurses Network and Nurse Heather Manis for putting this together for all of us. I'm really excited. So with that being said, don't hang up, Dr. Blair. I'm going to just end the show with another little video and just reminding you all really, truly what it's all about. It's all about living your best life and helping others do the same. So please share this video with everyone that you know and love. And we're grateful. And I will be going live next week from the Cannabis Nurses Network conference, which is the future of nursing is what? Cannabis. It's endocannabinoid system care. So thank you for joining us. Live your best life and help others do the same. We're here to educate and empower patients to make choices that are best for them. We're also here to decrease stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I was cannabis agnostic for many, many years. And the more research I did, the more I discovered that cannabis is this amazing medicine.
I was told that I had a 4-stage pancreatic cancer. The doctor really told me he couldn't do anything else. He gave me her name and she called me and she came to my house. She started to give me cannabis. My oncologist was puzzled because he couldn't find the cancer anymore.
All of the learning that we get comes from the Green Nurses Group, comes from their support, comes from their guidance. I trust everything that she says.
Simply meet people where they're at. The plant doesn't, stress to grow, so we don't stress to share it. We're healing people.
Cannabis has been used as a medicine for tens upon thousands of years. Here's the big message. Cannabis needs to be federally legal. We need to have laws that are the same across all 50 states that allow access to anyone and everyone who wants to utilize this powerful medicine.